We are at the Thistle, which is the first supervised injection site in the whole UK, right? Can you talk about the place we are in?
Yeah, so absolutely. So we've got the Thistle here, safer drug consumption facility. People can come here 7 days a week, 9 o'clock in the morning to 9 o'clock in the evening, and use drugs that they've bought off site under the supervision of nursing and social care staff, with a number of supports available to them while they're on site. We support people with not just their injections, but their wounds, their social needs, their housing, trying to link in and establish positive relationships with families. So we're trying to provide an absolute holistic picture for people. We're trying to create an atmosphere where people feel welcome, they feel valued, they're treated with dignity and respect when they come here. They're welcomed in as equals, no different to you or I.
Can you tell us the kind of story of how this place began?
So around 10 years ago, in 2015, we had an HIV outbreak in Glasgow among people who were injecting drugs away from home. We done a health needs assessment, and two of the major recommendations were for heroin-assisted treatment and a safer drug consumption facility. Our heroin-assisted treatment opened in 2019. We just needed a Home Office licence for that. It was fairly simple. However, there were legal issues around the safer drug consumption facility, and it's taken us until January of this year to get it open, between working with the Lord Advocate and Westminster and various political parties to support us. We had a lot of support to get here, and developing a framework that would allow us to operate safely without fear of prosecution.
What about the neighbourhood here? Can you talk about
So we're based in the Calton in Glasgow. The Calton is a well-known area in the east end of Glasgow. For a long time it's been known as quite a deprived area. We know there's significant drug use in the local area, and for a long time there's been significant injecting away from home, and we've seen that from the injecting paraphernalia that we would find when we were out and about, often in hidden places, bushes, alleyways and the likes, car parks. So this area was chosen because of its proximity to injecting sites and the public, but also we had existing services for people who use alcohol, drugs on this site, and it's a well-known site to the people we're trying to attract. We've been doing a lot of work trying to engage with the community and support the community, and hopefully we're starting to see some of the benefit of that with needle litter in the public area reducing. And we're working closely with police as well and local businesses to try and offer support where we can. We have a community engagement forum, and we try and talk to people about the reality of the situation. This is a problem that's existed in this area, and we're trying to be part of the solution.
So let's take a look inside.
Absolutely. So this is the reception. This is the first place people come to when they come in, and they're greeted to some of our reception staff. You'll see we've tried to make it really open and welcoming. Our lived and living experience reference groups are involved in the whole design of the building, from the very early drawings to selecting the furniture, looking at the layout, plants and decoration of the building, including naming of the building, because you'll see we have chat rooms rather than interview rooms, because what we've tried to do is create a space that's welcoming and feels safe to people, doesn't intimidate people. If they're new to the service, we would ask for some very basic details, initials and a date of birth, gender and a small part of a postcode, not even a whole postcode. And we would then open them up in the system. They would then be registered. So it takes nothing more than 1 or 2 minutes. They would then see a member of staff in one of the chat rooms just to talk about what they plan to use in the service that day. What drugs did they want to use? How did they plan to use it? Some people may just want to come in and use a shower in the clothing store. They may want to use our laundry facilities or our lounge just to sit and get a hot drink, and that's okay. Once people have registered, they would go through to the using space here. People come in here and they're welcomed by a member of the nursing staff, and we'll talk to them about what equipment they wish to use for the day, and everybody will be given a single-use tray with all the equipment they need for a single injection. We also have access to things like a vein finder. When somebody tells us, for example, they're injecting in their groin, we can say to them, well, look, you've got some nice healthy veins in your arm. So we're able to identify healthy veins for people to reduce the harm again into the areas they're injecting in. They get their tray, we encourage them to wash their hands. Again, it's about hygiene and reducing infection. And then they'll be allocated one of our booths. While people are here, they'll inject. The nursing staff aren't allowed to participate in that, so we can't participate in preparing or administer an injection. So what we can do is we can advise and we can supervise the injection. So you'll see a kind of change in the flooring here and the mirrors. That's to allow us to still give people a bit of space. So it's very intrusive to watch somebody injecting. People are used to doing it in hidden places and bushes and car parks. They tend to do it away from public view, so this can be quite intrusive. Our lighting can be dimmed, so we can make that easier. If people aren't comfortable with the mirrors, we can pull a screen over that. We try and make it as comfortable and safe for people as possible. Nobody's rushed through this, so we're not asking people to hurry. They can take as long as they like with their injection, and our nursing staff will give advice. We'll say, do you want to try somewhere else? Rather than somebody continually trying to get somewhere, we'll suggest that they try somewhere else and support them with that, with Accuvane. And if they've tried, we'll get them to change the needle so they've got a clean needle. And again, it's about reducing the harm in those injection sites, reducing the wound damage, because we do see significant wound damage, particularly because people are injecting high amounts of cocaine and there's lots of injections happening. And we're also on hand if, for example, there's an overdose situation, we can respond very quickly. You can see we've got this large space here, we've got privacy screens, we have emergency equipment, and all our nurses are trained to respond to medical emergencies. We've had 51 overdoses since the service opened in January. All of those have been resolved. There's been no fatalities. Only 10 of those needed an ambulance, because we try and manage as many of them on site as possible, because it's much less traumatic for the people using the service. So we've had some good outcomes from those overdoses. We can't say all of them would have ended in fatalities, but we know for sure some of them would. And it allowed us to identify, for example, in March, there was a batch of heroin that was extremely problematic. People were injecting and overdosing before they'd even finished the injection. So we were able to respond very quickly, and those people almost certainly wouldn't have survived had they been somewhere isolated on their own. So we are able to intervene quite quickly. We don't necessarily give naloxone as a first line. We will always try and go with oxygen first. So we will try and see if somebody's maintaining their own airway. We'll allow them to carry on and we'll observe. If they need oxygen, we'll administer oxygen, but only if they're still continuing to deteriorate will we then administer naloxone. So it's much more of a hands-off approach for people, which people are finding much more comfortable, much more trauma-informed as well. It makes people feel that this is a safe place to be and they won't be overwhelmed with interventions, because it can be intimidating for people.
So would you say that this is a trauma-informed care, what you provide?
Yes, we've worked very hard to make sure this is a trauma-informed service in the design of the service, but also in the training of the staff. Our staff have had extensive training to be part of this team. They were all very carefully selected. Lived experience were part of all our recruitment. They were involved in all the recruitment panels. And we have a psychologist as part of the team who almost constantly delivers low-level trauma-informed training to ensure that remains a theme throughout our service. So we're able to have a consistent, positive, trauma-informed workforce that are really able to engage with people who've struggled to engage with many services up until now.
There is this prejudice in society that people with addiction are not motivated to ask for help. What do you think about that?
People coming here are so stigmatised. They're ashamed of what they're doing. They're ashamed of themselves. They're ashamed of their appearance. What we're doing is we're saying to people, come in here, don't be ashamed. If you're using because you enjoy using, that's all right. You don't need to hide that. If you've got other things going on, that's fine. But it needs to be when people are ready. So what we're trying to do is take pressure away from people. And when we do our community engagement work, we're trying to talk to people about their stigmatising behaviour and the impact that may have on people. If somebody's ashamed and stigmatised, they're much less likely to approach us. So let's try and encourage people and support people.
So if you finished injecting, what happens?
Yes. If somebody needs, for example, wound care, we would take them into one of our health rooms, where we also have the sexual and reproductive health and the bloodborne virus team. We offer hepatitis A and B vaccinations, flu vaccinations, COVID vaccinations. We provide testing every day, and we'll offer treatment to people as well. People can come in and access these areas without using the injecting space as well. So once somebody's used, they can come into the recovery area. Again, this area is staffed by nurses. We can keep an eye on people's oxygen levels. We can keep an eye on their pulse, their temperature, just to make sure that they're as well as they can be. Most overdoses are happening very quickly. You know, they happen very soon after the injection, but there's always that risk that if somebody's had something else before they come in, because in Glasgow a huge amount of people use benzodiazepines. It's a huge issue in Glasgow.
Have you encountered any drugs that were laced with nitazines?
So yes, in the overdoses we had in the end of March and beginning of April. We don't have drug checking at the minute, but what we were able to do was get some of the spoons that the drugs had been prepared in, and the local forensic lab was able to check those for us, and they did identify some nitazines in those. And that's what we found is another benefit, is we're able to see very marked differences in the drugs that are coming through and what people's experience of those drugs are, and we share that with partners very quickly.
Do you provide any special care for women who use drugs, like gynaecologists or something?
So the sexual and reproductive health team will be able to provide women-specific health care. Our GP service that's hopefully coming in, I've got a strong interest. It's a female GP, and she's got a very strong interest in women's health care. In the recovery area, again, the chairs were picked by the Women's Reference Group, so they allow people, if they're a bit sedated, to keep their airway open, but also not fall off and slide off. So they can sit, they can sleep if they want to, that's okay. We've got nurses there supervising and observing, access to oxygen, access to observation equipment. And again, it's another opportunity to engage with people and just have a quick chat with people. What we generally find is people using cocaine don't use this area very well.
The cocaine users are more agitated after the...
Yes, sometimes there's a degree of agitation and they're keen to get moving quite quickly. While they're not likely to have an overdose as such, they could potentially have cardiac problems.
All these 51 overdoses were opiate related?
They're all opiate related, yeah. And recently we've seen some ketamine use. Some of that is people knowing they're buying ketamine, but some of it appears to be people wanting to buy cocaine, for example, and there's a lot of ketamine in it.
I read in the media that you placed a few needle bins outside of the service, and there was some anxiety about that.
So yeah, we've placed four in total, 2 in the city centre and 2 over in the Calton area, one at Morrison's, the supermarket there. There was some public anxiety around that. However, what we've seen with those bins is that they've been well used. The one at Morrison's had to be emptied fairly recently, and we did have a manager there tell us that he'd seen a marked reduction in needle litter round about there. What we also know that when we emptied them, there was more than just illicit drug equipment in there. There was prescribed medication had been used of and disposed in those bins as well. Remember, it's not just people taking heroin and cocaine that inject drugs. You know, people use weight loss medication, they use insulin. There are lots of people who inject lots of things, so let's maybe try and think about treating everybody a bit more equally. So the bins have been proven to be very successful so far. So once people are finished in this area, we'll take them through to the lounge, and you can see the lounge is much less clinical. It's much softer. Our Women's Reference Group were key in designing this area. This area is designed to be a place that people can spend time and they want to spend time. You see, we've got books, we've got jigsaws, we've got access to other health interventions, so we've got naloxone, we've got condoms, and we give out foils and one-hit kits for when people are leaving. People can stay here as long as they like. They can use our Wi-Fi. We're happy for them to use this as an address for mail and correspondence. This was one of the suggestions from people coming to the service, that they wanted something that gave them a wee bit of hope. And so basically these tags are here, people can write whatever they like on them and just hang it there. So that's proven actually very popular already. That's only been up just over a week. We're getting lots of feedback from the Service User Forum, a lot of positive feedback, but lots of suggestions of things we can do differently. So we're trying to take them on board. People have asked for art supplies to do art groups, and we've said absolutely. So we're in the process of making that happen for people. What we've tried to do is give people an environment that looks good, that's welcoming, that's comfortable. So if they want to lie in those couches and go for a sleep, by all means they can do that. We've got access to hot drinks, cold drinks, some snacks. We can encourage people to re-engage with families if they're finding that difficult. We can support them with that. You know, often what we've heard from the family reference group, and mothers in particular, is the wait and that chap at the door from the police. They don't know if their son or daughter's alive or dead. So we can say to them, do you want to phone your mum and let her know you're here and you're okay? But it's no pressure, you know, if they don't want to do that, that's fine. But if that's something they want to re-engage with a family member, we'll support them to do that. Our social work staff and our harm reduction workers are based in this area, and what they're doing is really just trying to see what people need from us. We don't want to put people under pressure. We can go next door to heroin assisted treatment. We've got access to same day opiate replacement therapy in Glasgow, so if people come in and tell us they want to go on a prescription, we can access that the same day for them. That's easy for us to do.
One of the criticisms I've heard about this service is that the state should spend scarce public resources on abstinence-based treatment rather than harm reduction. What do you think about that?
So in Glasgow we spend a huge amount of money on abstinence-based treatment. We have a wide range of services, but actually it's a tiny part of our service. We provide care and treatment. We have abstinence-based residential services, so people can get rehab from a varied number of resources. So if they want a 12-step model or a different model, we can access that for people. We put huge amounts of people through rehab every year in Glasgow, and we always have done. We've also got community abstinence-based resources. We've got a vibrant recovery community of people with lived experience who are abstinent, and they were really involved in designing this service. They really supported us. So I think, you know, the idea that we don't fund that is an absolute myth. We have a huge input to that, and it is really successful for some people if they're ready for it. So we would absolutely support that.
How many clients have you had so far here?
So we've had 404, I think, people registered in total. That equates to almost 6,000 visits and over 4,000 injections.
Does this place belong to the NHS system?
Yes, so it's part of the Health and Social Care Partnership, so it's the National Health Service and the City Council that run this.
Who is funding it? Is the Scottish Government?
So the Scottish Government are funding the entire staffing model for the first 3 years. We do have an independent evaluation being undertaken as well to look at what works and what elements are working and what the outcomes are for people. But we already know we've had some really positive outcomes. Obviously, the overdose responses is a huge one. But if you think there's over 4,000 injections, that's 4,000 opportunities not to transfer a bloodborne virus, not to leave a needle lying for somebody else to pick up, and not to reuse a needle. So we've kept people out of hospital. So we know some people here have previously been in and out of hospital very frequently, and we know that's reduced. The evaluation will be able to prove that for us. People talk a lot about this service being expensive, but the reality is we're saving other parts of the service an absolute fortune.
What do clients complain about the most? Like, is it housing? Is it family problems?
So by far and away, most of the referrals people are asking for are housing. There's a major housing crisis in Glasgow at the minute, and we have strong links to housing. There's a housing first team in this building. We have out of hours access to housing, so that if it's 9 o'clock at night, we need to get somebody accommodation. We've got somebody we can link them in with. It will likely be hotel accommodation, but it's still accommodation.
Could you please talk about the heroin maintenance program here in Glasgow? How is it accessible for people who use drugs?
The heroin assisted treatment program in Glasgow is called the Enhanced Drug Treatment Service. It's just in the very next building there it is, and I also manage that. So that's been established since 2019. That is more of a referral based system, whereas here anyone can walk in. However, referrals can be taken daily. So people have come here, for example, and been referred in and started very quickly in heroin assisted treatment. We've got 40 spaces in that at the moment, and it's accessible to anyone who's using opiate based drugs. It's a simple referral in either from a GP, another service, or we will take self-referrals. So people can access that very quickly as well in Glasgow, and that's also managed in the same way under the NHS, so there's no cost to people coming through the door.
So how would you explain to people who don't know much about heroin-assisted treatment what are the benefits and why should we do this?
Absolutely. So the people we see next door in heroin-assisted treatment are people who, for a number of years, have tried traditional opiate replacement therapy such as methadone or buprenorphine, and it's really not worked for them. They've struggled to engage with services. Heroin-assisted treatment, they'll come, they'll receive diamorphine, and we prescribe that, and people will self-administer by injection. They come twice a day for that, and what we've seen within that service is a reduction in prison admissions, a reduction in hospital admissions, and an increase in engagement and an absolute reduction in opiate use. So it's huge benefits. So again, we're saving a lot of time and effort by keeping people out of hospital, but crucially, we're keeping people alive. Nobody has died while they've been in the Enhanced Drug Treatment Service programme, and we're improving people's quality of life, and you can't put a cost in that. And we're seeing real strides in people's potential for recovery. They're getting into accommodation, they're physically improving, they're not spending time in prison, they've got a much better quality of life from coming to that service, so it's a real benefit to us.
What keeps you personally motivated to do this job?
I've done this job for a long time, and I know the people coming through the door, and I've known them for a long time, and I think it's purely by luck. That's not me, and we need to be better. In other parts of the health service, we don't treat people based on whether they think they deserve it. We just accept everybody in, and I don't see why the people coming here are any different. I really enjoy my job, and I'm fortunate that I work in an area where actually from a senior management level we're allowed to take chances and take risks and do things a bit differently, and we've got fantastic services in Glasgow, and I'm really very proud to be part of that. But I think for me, seeing people coming through the door and chatting to them and seeing people in here relaxed and comfortable and warm and dry is just, that's all you need. That's good enough for me.